name is Paul. I'm a mental health consumer rep. I'm 70 years old and I've been experiencing depression for some 30 years. So I grew up in Muswellbrook in Upper Hunter. I'm one of 8 children, but I grew up in a household where the expression of emotions was discouraged, even happy ones. So part of my survival mechanism was to withdraw, avoid conflict, and that also helped me survive my school years. My first career was in banking. My dad suggested I should join the bank for financial security, and it worked okay for 23 years, and then I was retrenched. At the time I thought it was a good opportunity, but I underestimated the emotional impact that would have on me. So that's when I was first diagnosed with depression. It was challenging to be diagnosed with depression because I really wasn't expecting it, and it took me a while to really get diagnosis. I mean, my first symptom was getting headaches, and so I went to a GP and they couldn't explain it medically, so I ended up going to a counsellor, and they started my journey of understanding myself and first of all dealing with perfectionism and moving on to my early life challenges and how they've affected my personality. It was challenging because initially I was pretty embarrassed about it, and so I guess I would have been affected by the stigma of having a mental health condition. But in the end I used it to help other people because I was able to encourage other people to be diagnosed and treated. To manage that mental health condition, I do a number of things, including regular exercise, connecting with family on an emotional level. I'm also involved with a music ministry. I aim to try and use my tough experiences to help other people because my second career was in helping long-term unemployed. My later careers were involved in working with prisoners and their families, with homeless people that had addictions and anger issues and stuff like that. So I was able to use my previous experience and my ongoing training to intervene and encourage them, reassure them that people do care and that there was people around that can help them. 2017, I got involved with the network. I was invited to join the board, which I took up the option, and I went on from there to become treasurer. I also got involved with the training program, so learning about mental health advocacy, how to work with committees. It was really encouraging to learn about advocacy because I'd probably been starting to do that already, but I think the training really refined my skills, and also being on the board, it refined my skills in terms of committee processing. So no, it's been a fantastic opportunity because I really feel like I can use my experience and my training and qualifications to help other people. So it makes all those past painful experiences worthwhile. But it was just nice to get back in the saddle and use those skills. Some of the skills I acquired or sharpened up were advocacy, working with public servants and how to network well, and I learned the importance of listening. I learned all about acronyms because Canberra's a really public service town, but I think the most important thing is it's systemic advocacy. So while it helps to have some skills about being able to represent yourself, systemic advocacy is all about making sure that public policy is fair and reasonable for consumers. Consumer rep work is actually really good because it keeps you in touch with what's happening in the health services sector, and so as a consumer rep you get to hear what's happening and the advances in the industry, so you pick up some really good tips on self-care as well. Being on a number of committees, I need to have good self-care, and so manage my mental health and make sure I let the consumer rep organiser know when I'm under strain and ask can I withdraw if necessary, but at the moment it's manageable. And I just make sure it's in my diary, and when it comes up I make sure I read the meeting notes. I remember to ask questions, and so sometimes I ask what might seem like a dumb question and make sure that I get clarification. I think having the humility to ask dumb questions is it's pretty important, because often other people are sitting there thinking the same thing, but they're not game to ask. I really enjoy working with the network because they're a team of great staff. I've found everyone compassionate and enthusiastic and well-meaning, and they're always ready to intervene if I need help. Some of the wins I've had has been on a committee where we reviewed the search policy for people who are in a forensic mental health facility, and so it was really encouraging to work effectively with the staff. And I was also encouraged to see that the staff in that facility are empathetic and they're just as concerned about the consumer rights and the dignity of the people that they look after. So that was really encouraging. One of the really useful outcomes of having this training and experience is I've been able to help other extended family members who are going through things like dementia. I've been able to help that family member to navigate the minefield of administration. The things that make my work as a consumer rep rewarding are knowing that I can actually still use my painful experiences, my skills, my qualifications, and I can contribute to society because I'm not dead yet. One of the things that I've found hard is actually retiring because I never really wanted to give up being active and helping out. So while I don't have a paid job nowadays, I still lead a very active life, and I'm able to have good time management, and it makes me satisfied that I can actually get some achievements in life. It has made me more confident to talk about mental health and overcome stigma in the community, because there are lots of people in the community that are being held back. Painful experiences actually can be quite useful. They're not real fun at the time, but we can learn from those experiences and share with other people on the tools, the processes to try and overcome those battles and still be successful and feel self-satisfied. I really encourage the people that's watching this video and listening. It might feel challenging to go and do studies and work in a committee, do a qualification, but it's very much worth it, and it'll help your personal development.